Before a person is injected with a needle that make him not feel a pain.
We use sharp reamers to remove the cartilage and a small amount of bone from the acetabulum.
My dear, is this what you want me to go through just to have hips? Oh no, this is too painful. In fact, all this trouble just to enlarge my hips.
We hammer in or impact a metal socket followed by a plastic liner.
Forget it. I don't want to be sick. I'm out of here. I can't do this just for hips. Yeah.
Every week, 1 million Americans, ladies, or more than 1 million Americans have undergo cosmetic surgery. Surgery is one of what happen for different reasons. Many years ago, before it was take time and you remain with a big scar or leave a big scar, but today it can be done in short time and use a small space, and the scar is difficult to see. They use more term or more words, but for today, let's talk about the 3 only words they use. First word is emergency surgery. Emergency surgery is happen when someone is sick and needs help from hospital. Second one is elective surgery. Elective surgery is not emergency. It's like there's something they wanted to take from your body, but not emergency. Number 3 is consecutive surgery. Is the surgery we're going to talk about today. After receiving more questions about it, this surgery is done in order to increase or decrease the body part, like to make the breast stand up, increase the lips, hips, and nose. All of you have asked this question and I wanted to know where they do it in Africa, Europe. Welcome to Young Future. We enter together in the room where people apply surgery. Let's start with surgery called the BBL. BBL, Brazilian butt lift. This is one surgery people doing every day. The number of the people keep adding each and every day. This surgery is done for the people of increasing hips. To do this, they take fat from other part of the body and attach it to the hips. It's understood that they got from belly or somewhere else, but most time they remove it from belly and belly becomes small, then add to the hips and make hips bigger. In Brazil, beautiful girls, she's a girl has a small belly and big hips, as you see on these pictures. This method is called deposition. This method is also used for the people doing sport party too small. They can use this method to add fat on their body. Let's think about it. This surgery can be applied to all people or there are some you can't do it. First in your choice, because there is no country force a person to undergo surgery based on person choice. And before they check on your body, they do all examine like BP and the other, because in case they make a mistake, there is a chance that it will not going well, and you must have a fat from one side. They take from one side and add it to the hips. Again, you must have 18 years old plus. How this works? Let's see one by one. And what else you would like to know about this surgery? Before a person is injected with a needle that make him not feel a pain, like they do to everyone at the doctor's surgery, this needle called anesthesia. Some they are general anesthesia. If they just want to remove the small fat, they don't apply general anesthesia. They just are used for the small part. To remove fat, they use suction device.
Brazilian butt lift has to be done under general anesthesia. It doesn't have to be done under general anesthesia, but I highly recommend you do it under anesthesia. So
This device they use to remove fat from one place and take it to other place. To do this, they connect with other pipe called the cannula, and this cannula injected where there is a fat. Then suction device start pulling all fat to the pipe. The fat are needed, it depending with how big you want your hips or the part you wanted to add is going to look. Some they remove 5 to 7 cups. This is small cup for $250. Now everybody understand When they remove the fat from belly, the belly becomes small, and where they put like on hip, the hip become bigger than belly. And that kind of the girl, she's looking beautiful in brazier. After they remove the fat in your belly, they clean it using a machine, and they add to your hip. To add this, let's see how they add on your hip. Next step, a doctor make a 3 or 4 incision in the hips and inject the fat using a pipe or syringe. They do it quickly and they close the place where this happened, and they do it without stretches to prevent scars. It depends with material doctor use. Some cover and the other use things like
connected to a suction device, and this has suction. This is just a vacuum, and it has suction that gets. And what I use is one of these cannulas here. It has little holes in it here.
Super glue which come close without to show scars. After anesthesia, doctor check you sometimes. This followed by vomiting and some pains. Then after 6 months, a doctor can say that operation went well, successfully. After all things, doctor give you some rule you need to follow, like sport and eat food has a protein for making your body work well, and you need to go for examination every 5 years. Again, any problem you advise to go faster for checkup. And you make sure you won't be fat, because original fat no need to mix with this kind of fat. That's why doctor tells about the size. You no need to go down or up. That's why you need to eat well. Why do they apply this surgery? BBR is one that lasts more than other like CBL. Before we continue, let's answer some questions. Someone has already asked, let me read the first question. The first question she's saying, I think she's saying, I'm in Surgeries. Where can he undergo this surgery? I don't know where Surgeries is, but in our next video, we are going to talk about which place is nearby where you can go under this surgery. As advice, before you go to under surgery, you need first to go to check up or to know that what you are doing is well. The second question is talking about, let me read the second question. I'm Angela from Nairobi. I think this one she's in Kenya. How much is this surgery? When I answer you first, it depends with the doctor, but almost of them, the normal price is $80,000. So you can calculate using where you are how much it can cost. Then is there any problem to apply this undergo surgery? This is the kind of the question we are going to answer in our next video. What else? We've got a lot of questions on this video, but some of it is like this one is similar with the first one she has asked. I'm going to answer in our next video. What else? Okay, in short, in our next video, we are going to answer this kind of the questions. Pascal, she asked, how can I know if someone has already applied this surgery? So the good to answer, because these days there's a profession to do this. If you didn't know someone before and you see for the first time, you can't tell that no, this one she has applied, this one she doesn't apply. You can't know that this is natural, or maybe this she has added some fat on her hips. But if you want also to apply, you can go ahead. And in our next video, I'm going to show you the hospital, because we already have a lot of hospital here in Africa where they can do it, where they can add your fat and they start looking beautiful. Thank you for being with us. We are with James. Please, if you haven't yet subscribed to our channel, this is the right time to click the subscribe button and activate the bell so that each and every time we upload a video, you'll be notified.